Back to health care. If employers have to pay for health care completely, we're talking about a restaurant, a small restaurant, for an example, or a small bar, or a large hotel, or a small hotel, or whatever. The cost, is it feasible?
Well, if you look at it on an individual basis, if you're talking about a small restaurant that's maybe family-owned, maybe employs 10, 12 people tops, probably go out of business because they really can't afford to pay a healthcare premium for 10 or 12 employees and stay in business because of the cost of the healthcare premiums. As you get larger in restaurants or in hotels or larger establishments that employ hundreds and hundreds of people, the healthcare, because of the size, may drop in the premium because of the number of people that are enrolled, but by the same token, that cost needs to be passed on somehow, either into the consumer by menu price increases or hotel room price increases, because the profit margins that were in the food and beverage industry as well as the hotel industry during the booming 80s is not there anymore. That margin is just not there. There's an oversupply of hotel rooms, an oversupply of restaurants. The traveler is more educated, is more conscientious, being cost conscious, being health conscious of where they could go. It's no more that there's only one or two restaurants I can go eat in, or I will always stay at a Hilton because that's where I want to stay. They'll stay where they can get the mostest for the leastest, to coin the phrase.
Now, interesting, we're talking about the most for the least. You know, in the last, let's say, 10 or 12 years, when you first started, it was 30 years ago, well, let's not go back quite that far, but go back to the early 80s. Would you say the price of the hotel room has gone down, stayed the same, or gone up?
Conservatively speaking, I'd say they've gone up to compensate for increased labor cost, increased cost of raw material, increased cost of utilities was a major factor in raising the base prices. The cost per occupied room in a hotel today is probably about $2.50 more per occupied room for the same amenity, the same service level you received in the 80s.
Okay, the question I'm asking is, I remember going to hotel rooms in the 80s, and you're saying a Holiday Inn, you would pay $49, $59, $69. The question is, I'm traveling and I see prices for the same hotel room between same prices, $49, $59, and what I'm seeing is there's much smaller hotels or less expensive hotels have sprouted up,
right,
such as your Hampton Inns, your Holiday Inn Expresses, your, Ramada Limiteds, your, Motel 6, for an example, and all these other have really decreased the price of a hotel room, for an example. And the same thing with your other restaurants. They've kept the prices down. Now, which is good for the consumer, bad for the employee and the employer.
Correct. That's exactly correct. It's a question of supply and demand. In the hotel business, we call it yield management or displacement. If an area has two hotels that have 50 rooms each, that's 100 rooms. They can play with rates, they can get a demand built up and pretty much control the market. In comes another hotel and another hotel and another hotel. Pretty soon you have 400 rooms serving the same amount of people that would have come to the 100-room hotel. So therefore, to stay in business, to be competitive, you have to be sensitive to price, sensitive to value received, perceived value. That's probably why you see some of these prices the same that they were in the 80s, if not lower. But then your astute traveler also knows that if he intends on having room service, if he intends on having the amenities he was used to at, let's say, a Sheraton or a Hilton in 1980, he's not going to get that at the Hampton Inn or the Holiday Inn Express or the Comfort Inn or one of those hotels. He's going to get a room. He's going to get a phone and a TV, and that's it.
Now, the question we're coming to is health care. How do these industries provide health care for the individuals if they're not making the profit, the margin is not there? What happens?
Well, there's two avenues that a lot of companies are looking into. One, obviously, is a large, and I shouldn't say large, I said immense group policy by the American Hotel Motel Association that they sanction to help smaller hotels with under 50 employees, I believe it is, to qualify for a small group at a very, very inexpensive rate. Now, the coverage is not so good. It's basic coverage. It's nothing special, no preventative and that type thing, but it's basic health care coverage. The general small hotel guy, like I say, with 10, 12, 14 employees, is going to suffer because he can't get the price break of a large group. A smaller group is going to pay top dollar for a decent policy. I really don't know how all this is going to shake out, but what I can say is that some of the group reforms that have happened over the past year, especially in the state of New Jersey, as a personal thing, I think is very, very influential on decisions that are going to happen down the road. No one can be denied health care because of their past medical history. Heretofore, the insurance underwriters had the right to deny insurance to someone based on their past medical history.
You know, that's a very important point. We've brought this out in the show on multiple occasions. We had an insurance agent here discussing that. It's very important. If you're working or if you're applying for insurance, you cannot be denied coverage because of prior medical problems. Doesn't mean that you're not going to pay more for the premium.
Correct.
Premium may be more, but at least you can get coverage, as opposed to in the past, the companies did not have to provide coverage. Now, you know, interesting causes, we're talking about healthcare. If you think about the industry, the hospitality industry, normally the people who are working in there are paying at a lesser scale than many of the higher positions. For example, if you think about a waiter, I was a waiter and I was a busboy as a kid. In those days, we used to make 30 cents an hour. It's better now, but it's like approximately $2 an hour is what the average waiter makes, or busboy, about $2, $2.25 an hour. And the rest is what he makes is on tips. Now, the interesting thing is you go to an employer to provide health care for this individual. Right now, you're paying $2.25 an hour. The health care will cost you more than the $2 an hour.
Correct.
It's just on the health care.
That's correct. It's a double-edged sword, Dr. Trocki, because we say it's good that everybody could be afforded health care. And I think that's important in today's age with a lot of single parents, a lot of people with growing up children. And we all know today's a little more difficult time to live in than it was before. It's more complicated. It's more modernized. It's more automated.
I don't know if that's more complicated. We make it more complicated.
True statement, but the fact of life is it's more complicated to live today than it was in simpler times. And I think it's a real step forward to afford to make available health care to anybody who wants it.
You know, I think the answer is going to have to be looking at it on a total. For, you know, obviously for someone who's in a higher level, financial level, making $25,000, $30,000, $40,000, healthcare can be afforded because it's a much smaller percentage. We want to talk about percentages in healthcare when we get back.